We have Nicole available now on WebEx, and then we will finish up our questions.
Madam Chair, can you hear me now?
Yes, we can. Please continue.
Excellent. I'm so sorry. I'm at work right now, and so I'm trying to move between two different settings. Madam Chair and members of the committee, my name is Nicole Yedlinsky. I am a family and sports medicine physician, and I practice in the Kansas City, Kansas area for a large medical center. I'm providing testimony in support of SB 131. As has been mentioned, Kansas is one of only 4 states that does not have clarity regarding licensure for team physicians who travel with their team to the state of Kansas. Sports medicine physicians have significant training in both treatment and prevention of illness and injury. We work very closely with our athletes. We know them very well. When we travel, those athletes trust us, and we are happy to help with their care. And this was never more important than when we saw a major medical emergency that was televised on national sporting event. It's important to note that the provisions of SB 131 for out-of-state team physicians are limited and temporary. It only applies to the short duration of time the team would be in Kansas for practice or competition, and really just for that sport-specific nature of travel. I hear the concerns of the Board of Healing Arts. There are other states that have similar clarity of these licensure requirements. You know, and it's just important for Kansas to have some opportunity for team physicians. We want Kansas to be attractive to sporting events, and we want to make sure that we have clarity for those team physicians who travel with their athletes. And I'll stand for questions.
And I believe we have a question from Senator Baumgardner via WebEx. Senator Baumgardner, could you unmute yourself so that we could hear your question?
There we go. So my question is, and actually this might be for the Board of Healing Arts. That's when I first raised my hand, but you know, we heard of all of the different teams that do have traveling chiropractors and doctors with them. How are they able to go into other states smoothly, provide those services? Have we looked at the language that they have in their legislation? And I think that Nicole also made that reference of what's being done elsewhere. So how can we make that happen smoothly in our state?
Yeah.
So
thank you for sorry, go ahead.
I was just going to add, Senator Baumgardner, that as mentioned, Kansas is one of only 4 states that does not have clarity of licensure. So this is not an issue for traveling team physicians who go into states other than Kansas, Oklahoma, Nebraska, and Hawaii.
Mr. Chairwoman.
Yes, Courtney.
I appreciate that and that point as well. I have looked at some of the other states' waivers regarding this, and generally speaking, they are a bit more tailored so that the board, whatever state medical board, has the ability to at least track who's here at the very minimum. So
I think I'd also like to add one more comment, Madam Chair. This clarity does not in any way affect that team physician who's traveling with the team to be subject. So if that team physician commits any crime, they are still subject to Kansas state law. If that traveling team physician commits malpractice, they are still subject to the their own state board licensing requirements.
Senator Erickson.
Thank you, Madam Chair. And this is for whichever conferee would care to address it. But I'm sitting here thinking, I'm assuming that we currently have sporting events where teams are coming into the state of Kansas that would qualify under this act. How is the treatment of the team currently being done without this in place in the state of Kansas? That's for anyone who wants to answer it. How are teams coming in currently being done?
Madam
Okay.
Chair, can I address that?
Yes, you may, Nicole.
So, for example, if a team is traveling to Kansas, and we currently would need to reach out to local team physicians or local sports medicine physicians to partner with them to provide care. I work for an organization that has contractual obligations for teams in both Kansas and Missouri. So it just so happens that I'm licensed in both Kansas and Missouri so that I can address those issues. But if it were the case that a team I was traveling with was in another state that did not have such clarity, then I would need to work with or partner with a local team physician, which we still do. Again, we always work with the local physicians because they're the ones who are aware of any emergency action plans or any such situations as that. It's just that we develop very close relationship with our teams. We know their medical histories, we know their current injuries, and we also have the trust of our athletes and staff.
Thank you. And one last question, Senator Petty.
Thank you. And I'll refer this back to Nicole as well. So Nicole, you mentioned that you have traveled with teams to other states. So when you do that, is there any kind of reporting or registering in some way with whatever would be the comparable board of healing arts in another state?
So as was mentioned earlier, that is state dependent, and it is also dependent on the nature of the travel.
Thank you.
Committee, I would address your attention to neutral written only testimony from Rochelle Colombo, from the Executive Director for the Kansas Medical Society. Committee, this closes our hearing on Senate Bill 131.
Thank you. Next, I have Dr. Nicole Yedlinsky. Did I mispronounce that?
No, Madam Chair,
virtual.
that was perfect. Yes, I'm
All right,
virtual.
and
Can you hear me?
you're with the Kansas Academy of Family Physicians. Welcome to committee.
Thank you, Madam Chair, Dr. Epley, and members of the committee. I'm here providing testimony on behalf of both the Kansas Academy of Family Physicians and the American Medical Society of Sports Medicine. I am a proud family and sports medicine physician practicing in Kansas City, and then I live in Leavenworth County, and I'm the team physician for Lansing High School. I'm grateful to Senators Pittman, Dahl, and Erickson for bringing forth this legislation. As has been stated, this just provides some clarity and a waiver for physicians or other healthcare professionals who travel from out of state into Kansas to provide care for their team. As you know, the physician-patient relationship is really special, and physicians know their athletes well, as has been recognized recently with some high-profile situations of athletes who have suffered pretty significant injuries. Having a physician and other healthcare professionals who know their athletes well is very important for their care. Oftentimes, as one question that was asked was about providing care currently. I do practice. I have a license in both Kansas and Missouri. So oftentimes what will happen is if we travel out of state, we will partner with the local physicians to make sure that the appropriate emergency action plans are in place. And just wanted to restate that these provisions are limited and temporary, and also that Kansas right now is one of only 4 states that does not have some type of waiver or licensure clarity for physicians who are traveling out of state. We want Kansas to be attractive for sporting events, and this Senate Bill 130 is one way to make that happen. So I thank you for your support, and I can stand for questions.
Thank you very much, Doctor. Appreciate it. Next, I have Brian Williams on behalf of the American Medical Society for Sports Medicine.
Yeah, thank you very much. I also appreciate the opportunity to address the committee. I'm Brian Williams. I'm the Director of Policy and Advocacy at the American Medical Society for Sports Medicine, which I'll point out is actually headquartered in Leawood, Kansas. We are a national organization focused nationally and represent sports medicine physicians in every state. But we're proud to be headquartered in Kansas and appreciate again this opportunity to testify. I don't really need to repeat everything that has been said. Dr. Yedlinsky is actually a sports medicine physician and aptly kind of described the necessity to travel with sports teams. Physicians often provide a continuity of care for athletes who either they're trying to prevent injury or maybe are trying to recover from an injury throughout the season, and to have a sports medicine physician or an entire athletics training team to go along with the team is very important, we think, for a continuity of care and for a proper medical attention to the athletes. The idea that there's 46 states right now that have some type of clarity. What we're looking for is a clarity resolved in terms of the medical license. So 46 states already have some type of licensure clarity, so that when a sports medicine physician travels with their team, there's either a waiver or some sort of procedure for them to practice medicine with their teams. And I again stress it's only with their teams, right, while they're out of state. And of course, Kansas is one of the four, as has been mentioned, that does not provide that clarity. On the liability issue, let me just mention there was legislation passed a few years ago at the national level in the United States Congress, bipartisan legislation that clarified at that medical liability level that liability insurance can travel across state lines for this very purpose. So that issue has been resolved at the federal level, and like was pointed out, each physician needs to arrange for that in their own medical malpractice liability insurance policy. So let me just conclude by thanking Senator Pittman. This issue was really brought forth by him and his team and the other sponsors of the legislation. We're really thankful for the valuable collaboration and help that we got from Courtney, the General Counsel at the Kansas State Board of Healing Arts. And we just believe that this legislation will clarify the issue so that teams can travel to Kansas and we can play sports. And I also will be available to answer questions.
All right. Thank you very much, Brian. I appreciate that.